patients pass through these doors every day. My journey into the curious world of Chinese medicine began here.
This is the largest hospital of traditional Chinese medicine in all of Beijing, probably the most famous in the country. All the people in this country have a choice of two completely separate medical systems. Western medicine, which is practiced very much the way our system is, although, they don't have all the facilities we do. Or this. This is purely traditional Chinese medicine with a few pockets of Western medicine here and there. But what they want is they want to be treated by herbs or needles or massage or meditation. That's why they're here.
So what kind of problems come in that door with them?
Every kind of known illness that we've ever seen in the West walks through these doors.
When you came in that door a dozen years ago, did you have trouble entering this world?
I still do, 12 years later. They're pulling out the numbers for people to pick up their medicines. This is Western medicine. That says soup medicine. These are
what
medicine soup. You buy the herbs. This gentleman collects his bag of herbs, and you go home and you boil them into a soup. There are hundreds and hundreds of substances back there that people are given as part of their weekly prescription for their severe medical illness. And they are there picking up these bags of herbs that they'll boil.
What kind of herbs are in there?
These herbal medicines. These are all herbal medicine. You recognize these? She said, I recognize the words, but I have no idea what the medicines are. And there are 12 of them here. So in each bag, there are these 12 medicines weighed out.
Why does she use herbs instead of Western prescriptions?
Oh, she's also taking Western medicine.
Same time?
So she's taking, not at the same time, but Chinese medicine and Western medicine. This is the herbal pharmacy. This is really the nerve center of this whole hospital. This is where the bulk of all the Chinese medical therapy is, right here.
Look at this. These look like scorpions.
That's exactly right.
What are those?
It is a scorpion.
I'm not wrong. And this? Look.
That's a gecko, a lizard.
That's a medicine?
What's the use of this? It decreases cough and relieves sputum. So that one treats the symptoms.
This?
This is ginseng root, but it's the cheap form because there's some forms that cost thousands of dollars.
Like tea.
Like ginseng tea. That's right. What is it used for? This, wait, this is great. This is to increase qi, vital energy. Qi. The best way we can translate that is vital energy, the force of life.
Sort of the life force?
Yes.
So that's what they say this does.
Will it grow hair?
Maybe. I don't think so, Bill. I've tried it. It
This
doesn't work.
one will. Look at that. Now, what's this one?
这个是什么？鹿角. Deer. These are deer stump of the antler shavings.
What would be a Western equivalent of this?
I don't know of any. This is a shaving of a deer antler. How often do you find that in the house?
But I mean, do we know what the chemistry is in these herbs?
We really don't. But the Chinese weren't interested in the chemistry as we know it. They're not prescribed because of their active chemical ingredients. They're prescribed because one of them increases heat and one of them decreases stagnation of vital energy. That's the language that they use. It has nothing to do with chemistry. They see the body from a different viewpoint. To them, the body is based on energy, balance. All these herbs, and this is where most of Chinese medicine happens, are prescribed based on this sense of energy in the body. Qi, they call it. Qi. what they call the boil the medicine room. That's what it's called.
Boil the medicine room.
This is as close as they will come to an inpatient pharmacy. Each pot has a prescription for one patient in the hospital. Altogether, there are 60-odd pots running at any moment, and every patient in the hospital gets their medicine for the day in these little thermoses.
So what's in these pots?
In each pot will be 10 to 15 herbs for each patient. This whole style of making these herbs is hundreds, if not 1,000 years old, and a lot of these prescriptions are 500 or 600 years old. It's the same prescription they used 500 years ago.
Is the formula written down?
Yeah, yeah.
Each one looks different, too. Boiling roots, boiling gecko. That's more like cabbage and collard greens. This is more like acorns.
What does it smell like to you?
I can't describe it. I mean, it smells like everything I've ever smelled. Tea,
Yeah.
gum, raisin, root. You ever tasted it?
Yeah.
When you were here?
When I was here, you know, to understand it, but it is awful. Awful, awful, awful.
I'd heard about operations performed using acupuncture needles as anesthesia. David took me to see one at the finest Western urological hospital in China, Temple of Heaven Hospital.
This is what's called the pituitary cella. This is the area where the pituitary gland sits, and it's enlarged. He's sure that this woman has a tumor smack in the middle of her skull. It couldn't be more central. Okay. And it's very large. 你多大？你可以猜一下。你给我手看。It's about this big, he's saying. That's a very large.
Just about the size of a quarter.
And what they're going to do is use a combination of some Western medicine and acupuncture anesthesia to perform the whole surgery while the patient is conscious, awake, and able to talk to us. 他们今天要用那个针灸麻醉。
是的，
对，你怕不怕这个？
我不怕，我一点都不怕。
They are giving her some, what we would call Western sedative.
Absolutely. And the point here is that she's using less than half of the amount of drug that she would typically use without acupuncture needles. And for many patients, particularly patients at high risk of anesthesia, this has a lot of benefits. Bill, I'm going to try and ask her some questions. 你听我的话吗？
这
好，你知道他们在，你知道你在什么地方？
手术室
是。你舒服吗？
可以，
很好。不疼吗？
不疼。
I just looked into her brain and saw the tumor, and she's talking to you.
They've opened her skull. She has no pain, and they've used less than half the drugs we'd use in the West. This must be very strange to you.
Well, I have lots of questions. The professional skeptic in me says that those herbs work because they have chemicals in them, not because they have chi. And that traditional medicine is a kind of placebo, the power of suggestion. On the other hand, I've never talked to more credible people than those patients in that hospital and the doctors. So I have mixed feelings. I'm skeptical, but I'm also, well, I'm open, because I think there's something here that might translate back to our society and be useful to us. But you, when you got here 12 years ago, when you arrived, were you skeptical?
Very. I had exactly the same questions.
What was your attitude toward traditional Chinese medicine?
It was really very simplistic. Does it work? And if it works, how does it work? And if it works, how much of it is the placebo effect? Is it just people's belief, or do the drugs work? Do the needles work? Does the meditation work? I asked all the same questions that you're asking. And I didn't know a thing about this qi, this vital energy. In fact, it wasn't until I was in the traditional medical college here for months that my teachers finally drove it home that the whole system is based on this odd thing called qi energy. I came here without ever hearing of that before. This is the acupuncture ward, but these people aren't here for acupuncture anesthesia. They're here to treat all their different chronic diseases.
With needles?
With needles. I asked her if it hurt. I asked her if it hurt. And she said it doesn't hurt. And he said, the doctor said it doesn't hurt.
It hurts me.
It's hard to watch. This woman has what we would call Bell's palsy. It's a paralysis of her face. And this doctor, who's been practicing acupuncture for 60 years, is treating her by putting needles in her arm and her face.
Where exactly is he putting them by his light?
He's putting them in what he calls the large intestine meridian.
I don't understand that.
Well, the body in Chinese medicine is made up of all of these circuits of energy.
So the circuit or the channel from here?
Circulates through the whole body and is called the large intestine meridian.
Professor, may I ask you something?
Can
you simply explain this to me? These are meridians?
Yes.
Meridians are channels.
Yes.
This is where the needles go.
这是打针的地方，对不对？
There really is nothing like this. I mean, we have the nerve charts, the nerve paths.
This map has almost no correspondence to anatomic maps we use in the West.
So this is a completely different geography of the body?
Absolutely different. It doesn't correspond to nerves or arteries. Their way of finding disease and getting to it is totally different from ours.
How does he know that he's hitting the right point?
He's asking her in Chinese, de qi, which means do you feel the qi? Do you have a sensation? 有感觉吗? She has a sensation. So that's how he knows, and he also has to feel it. You know, my acupuncture teacher said it's like fishing. And you know the difference between a nibble and a bite?
Yeah.
That he puts the needle in, and if it gets a little stuck, if there's tension pulling back, then he knows, even without asking the patient. But, you know, to me, it's an art. It takes a long time.
站吧，往上面站，
没站，往下没站呢，
现在站了。
没站呢，站了。
Did they teach you to do this 10 years ago, 12 years ago?
They tried very hard.
How?
Well, they put me in a room with a teacher and said, memorize these points.
All the points on the body?
Well, and they painted me with iodine dots. I had to recognize all the dots on my own body, then on their body. Then the practice exercise was 10 pieces of paper. If I could put the needle through 10 pieces of paper without bending the needle, then they'd let me near a patient. Until I could do that, no go.
Did you finally learn it?
No. I mean, I got to the point where they let me put needles into people, but I never felt it pulling back. I never felt the qi. It's a very difficult thing to learn.
经过 X 线检查和
Millions of Chinese routinely choose acupuncture to treat their illnesses. But I discovered Chinese doctors don't need the acupuncture needles to manipulate qi. They can use their hands.
Massage is taken very seriously, like we would have surgery or pediatrics or OBGYN. Massage is one of the main units of the hospital. These are all doctors. These are people who graduated 5 or 6 years of traditional Chinese medical school and then did a residency of at least 1 year in the hospital and then passed a formal series of examinations and specialized in massage.
Did you study massage here?
I did. This man in the center, Dr. Zhang, is my teacher and one of my favorite teachers, actually.
Dr. Zahn, in the West, we think of massage as making the muscles feel better, but it's much more than that here.
骨质是给他束缚。
哎，不是舒服，要给他治病，啊，他有病，我们是要给他治病的，把他有肿块呢，让他消掉。
These two women have what we would call fibrocystic breast disease. In the West, we don't have a treatment for this disease. A lot of women suffer a long time, so if he's really helped her, that would be an example where we can't do very much.
So is it your hands that are doing this? Does he have special hands for this?
He has unbelievably gifted hands.
What did he teach you about using your hands?
Well, the first time he taught me, he brought this bag of rice that he uses for his students. And to show you what he said, you know, he threw down the bag of millet in our little room, and he said, when you can learn this hand manipulation so that you can crush this millet or rice into dust, then you're ready to work on a human patient, not before.
How does she feel?
喂，请问你对按摩怎么样？你想有好处吗？
有好处，我
肯定是有治疗方法。
因为以前我用什么药物治疗啊，用一些其他的那个外服药啊，什么内服药啊，都感觉不是很理想的。结果我治疗几次，就是经过 B 超嘛，还有 X 光嘛照，好多了。现在已经没有什么胀疼的感觉了。而且肉块也消得比较。
你有很多这样的病人吗？
对，
多少？
搞了27例。
怎么样？那个27？
他这27例啊，11例好，完全痊愈的。有的呢块儿变小了，啊，2例是没有效的，但是其他的都是有效的，效果都比较理想。
What are you doing here?
现在做多少呢？
他是肝气郁结，所以我就要再选这个穴。
Bill, he believes that qi in her liver is the cause of her breast disease.
Why is he dealing with the liver and the spleen way down here, almost to the ankle?
In his way of thinking, the body is made up of these conduits where the qi goes all through the body. He's working on the liver using this point down by the foot because the liver meridian flows down the feet. And unfortunately, in a certain part of it, according to him, it's stuck. So he's got to push it, move it, help it flow. And then in his way of thinking, the breast disease will become better.
Why? What's happening when that qi is flowing?
I can't tell you. If I knew, I wouldn't have to keep coming back here.
Show me how my qi flows.
你像我在这个地方，我让你往下。 这个地方，用这个手，我可以让它往上。I felt that.
Yes, yes, I did feel it, like a blood flow.
哎，这个是往上去的。
Yeah, it's right there. At dawn one morning, David took me to People's Park in Shanghai. He said if I really wanted to understand qi, this would be the place to do it. This is extraordinary. This park is absolutely full of people doing exercises.
Yeah. And all over China, the same thing is happening.
Every morning?
Every morning, in every park in China. But these aren't exercises like we think of them, you know, aerobics, sit-ups, and push-ups. This one, for example, is part exercise and part martial arts. The Chinese name is Tai Chi Chuan. This is a kind of exercise that's centuries old. There's this idea in Chinese medicine that the body has to move, that movement is as important as eating or sleeping. And 23, 24 centuries ago, they started to write pictures about how people should move to keep the body healthy. So they're moving, but it's more than that.
What do those motions, those physical attitudes have to do with qi?
If you ask this woman, she will tell you she can feel it. She can actually feel it, and she can move it. And in the Chinese rhetoric, that is health. If you can do that, you're healthy. If you can figure out where your center is, your right, your left, and how to concentrate your mind, that defines health. The idea is to connect with nature through movement. There's this old expression that the body has to be like a hinge on a door. If it's not swung open, it rusts.
What's he doing?
Moving. This man is doing Qigong, although it looks like he's just rocking back and forth. He's really trying to focus where his energy in his body starts from. In his mind, he's trying to plant himself so that he feels as though he's rooted like a tree. And his arms are probably moving in his mind like a bird. And with that, he will tell you that he can feel balanced and centered, and then he can begin to move his energy.
You believe that happens? Moving energy?
I have never experienced it. I mean, I practiced Tai Chi for a year and felt deeply meditative and centered and balanced. I never felt the energy.
Why did you give it up when you went back? You don't have to just be in China to do Tai Chi.
Because I became an intern at a big teaching hospital. I had to be at work at 6:30.
So your health was no longer as important as other people.
It was as important, but I could no longer take care of it the same way.
Now, what does that say?
It's a relatively recent phenomenon that Western medicine has suggested that calisthenics and aerobics and taking care of your physical stamina is essential to maintaining health or intervening in illness. To the Chinese, they started on the other side. They said that's a basic principle. You can't have health unless you maintain your body and use both physical exercise and mental meditation to be healthy. What this gentleman is doing, when I first saw it, looked so strange to me. He's doing what's called moving Qigong, walking Qigong. He's trying to meditate while he walks. He's walking, with a purpose, to move his energy with every step.
What's happening to his body while he's doing this medically? Do we know?
Well, he's not getting a cardiovascular workout. I mean, it's not like he's on an exercise bike or a treadmill. But, this is one of the big questions. Do any of these martial arts change people physically enough to alter their disease or make them live longer? You ask me as a Western scientist, I don't know. But what I know is that there's hundreds of millions of people out in the fresh air every day and have been for 24 centuries with the belief that if they do these exercises, that's how they'll maximize their health. So the question to Western science is, are they right? Or are they just all deluded?
I can see that although traditional Chinese medicine seems alien to Westerners, does have something to offer our practice of medicine. On the one hand, there's the practical contributions it can make, herbs for certain diseases, acupuncture. But there's another level that's becoming clear to me. And to these people, it seems that health is not just the absence of illness, it's a philosophy of life.
Right. The idea is that the way you live your life, your thoughts, your emotions, that's what shapes your health or your illness.
That philosophy goes back a long way, doesn't it?
Yes. Very, very long way. It's based in Taoism. And Taoism, this is a Taoist temple, the White Cloud Temple, built in 500 years ago. But, you know, by the time this temple was built, the Taoist ideas of Chinese medicine had been practiced for 1,500 years. In the old days, the doctor was very much a teacher. It wasn't just somebody who felt pulses and gave herbs, but had to be a role model, had to teach somebody how to live in the society. Their role was to teach people the best way to live, and that would help their patients maximize their health. It's a very, you know, it sounds rather odd, but it really raises the question, does the way you behave and the way you think and the way you feel, does that change your physical well-being? From the very beginning, 2,000 years ago, Chinese medicine said, that is what changes health.
This man is one of the more gifted people that I've met in China. Professor Wang Jinhuai.
You studied calligraphy under him when you were here?
Yeah. And he, partly because of his training and partly because of his interest, is also a scholar of Chinese medicine because he knows Taoism. He knows the philosophy of the whole culture.
What he's drawing here, Bill, are the characters for water and mountain.
If I were reading about a mountain in Chinese, I would be seeing that picture.
You would be seeing it, knowing it. He's feeling it.
我写山，我好像我在山上；我写水，好像我就是水，好像我就是在水里边游泳。那么这样时间长了呢，就是这个入静、安静。当你入静，当你安静时，这个气呢，它在这个身体内部的这个运行啊，就是比较怎么说呢，顺利的，是流畅的。这个气在你的身上啊在走。
所以你用气。
所以我也用点气，但是这个气呢，跟那个一般我搬东西或者我做什么这样的这个不大一样，而是一种内在的这个。
He has to control his qi like somebody doing the martial arts in order to get the meaning right.
就是中国的这个哲学啊，古代认为这个宇宙啊，它在没有宇宙之前就有元气。那个气呢，一直在这个宇宙里边这样运行，这就是我们看不见的，也摸不见的，但是它在我们身上它是起作用的，是这样的。是个这个，就是它是一团元气，这样的东西。这个名字呢，也叫混沌，就是，而且这个颜色有点淡黄的颜色。然后变了。
That's the Tao symbol, isn't it?
For yin and yang. Bright, dark, up, down, male, female.
So the earth, which was chaos, divided into
Yin and yang. In everything, in every part of the universe, there are these two opposing forces. They're interdependent. They can't exist without one another. Even in the picture, one ends where the other begins. And the struggle is in maintaining the balance.
Professor, what does this have to do with traditional Chinese medicine?
这个想法，这个来源，就是遵医的最根本的，它的原则和方法， 他的认识就是这个。《黄帝内经》讲啊，说这个阴阳事实啊，是你顺之则克己不起，人就不得病。
We're born in a balanced state, but we fall out of balance. There's this notion that the physician's job is to figure out where the body and the mind are no longer in balance, where the yin or the yang are too much or too little. Find it and either teach the person to fix it or use herbs or needles or diet to fix it. But that's the whole goal.
Balance.
Balance. And that all comes from this very, very ancient notion of yin and yang, the two forces of nature in everything. You know, calligraphy is worse than my acupuncture or my herbs. I can barely write my name in English, but he would tell me the meaning of every character and explain to me not only the meaning of the word, but this notion of balance for everything that exists in Chinese written words and ideas. That's what he taught me. There's a wonderful proverb in Chinese that says, a teacher for one day is like a parent for a lifetime. And he's a teacher. 谢谢。
David, what brought you to China in the first place? Why did you make such an enormous personal investment in this?
I don't think I was aware of it at the time, but looking back, I think it had to do with some personal tragedy when I was a boy. When I was 10, 3 of my grandparents passed away of unrelated illnesses. And the same year, I lost my father, who was 39, of a heart attack. And it was hard to think about why that happened. And I always wondered, is there more of a reason than just fate why people live longer or shorter lives? And does it matter how you live, how you think, how you feel? Does that change your physical health or your life? Or is that even important? So from the very earliest part of my interest in medicine, I was interested in more than just the chemistry.
如果说自己想不出那个小球，想到丹田里面凉堂堂的，里面有一只亮晶晶的小球。
A Taoist proverb says, when you have a disease, do not try to cure. Find your center and you will be healed. This clinic puts that proverb into practice. This is Shilin Hospital. It's primarily a traditional Chinese medical hospital, but it's most famous for this, Qigong.
咱要守住丹田。
These are real patients with real physical problems, and this is a medical doctor, Dr. Liu. Dr. Liu is trained in both Western and Chinese medicine.
要一守住丹田。
We've seen herbs, needles, massage. That's doctors doing things to patients to reestablish some kind of body balance. This is the doctor as the guide, teaching the patient to use their mind exclusively to change their health.
This looks like many meditation classes I've seen in the States, or classes in breathing.
Right. It is very similar. But in Chinese theory, once you've learned to relax, focus on your breathing and let go of all the thoughts, you know, where's my laundry and when is my car coming, then in Chinese theory, you can actually find a spot in your body where your qi, your energy, begins. And they call this the Dantian point. It's a spot just below your belly button, your navel.
Literally?
Literally.
Physically?
It's in your abdomen, your pelvis. So when they talk about find this ball at the Dantian point, they're talking about a ball of energy, which is where qi begins in the human body. And then with practice, while you're focusing on your breathing, while you're letting go of thoughts, the physician says, concentrate on this ball of energy and begin to move it. That's the skill.
But what does it do for the lady with arthritis or the lady with stomach pain?
They'll tell you that after weeks or months of practicing this meditative medical tradition and moving their energy, that their symptoms have decreased enormously.
五指往上走，就像五指啊，就像五条龙一样，五龙爬山一样。哎，对，好好，对，竖的彻底。
请你告诉我，你练功的时候你有什么感觉？
特别舒服，就是特别轻飘飘的，特别轻极了，就好像我这个人呐，不存在了，就那个晃晃悠悠的，这个就感觉到身上也不疼了，而且全身就发热，所以一热了以后，
这个是真的热，
真的热
是吗？
不是我的感觉哈，
不是思想，是真的热，
是真的热。它一热了以后，我自己就感觉到我很舒服。在这个舒服的状态底下，我又想动一动。我就是哪儿不舒服了，我就觉得我这样动一动以后，我就特别舒服。
这个难不难？
可是如果你就是作为一种无所谓的状态，或者是你想练练，那我觉得这个好像收效并不大。
The strangest thing David took me to see in China was here in Beijing at Purple Bamboo Park.
If you can believe that there is an energy called qi flowing through the body, that it can be felt and manipulated, then perhaps you can see why some Chinese go one step further. They call this teacher Master Shi, and he tells his new students, come here every morning at dawn for 3 years, and then I'll know you're serious.
3 years? Right, and that's just the beginning?
Yes, but I'm warning you, Bill. What Master Shi claims he can do just doesn't look real.
What's going on here?
Master Shi will tell you he just used qi to throw his student.
This is where a lot of the Chinese stories come of all the martial art masters. They could emit energy, and it wasn't just their physical force that beat their opponents, it was their qi.
But that goes against everything we know and understand in Western science. It defies the biophysical laws.
This is where Chinese medicine takes a wide turn off of what we understand and accept in the West.
我用的是和谐的办法，我给它合上。好，我这里是一个我，那是一个舌头，蛮分开。就是我的那个意念上那个地方去了。行。我的意念上那个去以后，我这个地方，那个就是我的石子，这是我的曲子，我这也不使劲儿。对。要产生这种状态。
对，这个不用力。
不用力，没有用力，他一不用力的。
对，没有抓我。我明白。
啊，
抓我的时候没有抓我。
我没有用力，我不是这么抓不动。这个我也告诉他，我是用那个思想，我的意念一动，我的意念是一种能量，一种东西在
你做这个的时候，你有什么感觉？多说是热的感觉还是电的感觉？没有感觉。
没有感觉。
所以没有感觉是什么？
太阳拉着地球转的时候，你有什么感觉呢？这个地磁场，你有什么感觉呢？你没有感觉的，因为它有一种平衡感。你别看老师隔着你打我，
来，
那就是你就他先退，然后你就棒他，实际上他就是对着。
啊。His hand trembles when he does that. Look, yeah, there it is. as an American student here studying this, what's happening?
What happens is, let's say I practice a lot of hard martial arts. I go in with my strength, and I push as hard as I can. And actually what happens is, his energy goes out of his body and into your body. So that you become sort of a marionette on strings. Where if he wants to all of a sudden jerk you with just energy, he doesn't have to move his hand. Suddenly every muscle in your body, every cell, expands or contracts.
But that defies all the biophysical laws as we in the West understand them. You don't emit energy. That's not the nature of things.
Well, I guess we have to advance our techniques of studying because whether I want to believe it or not, I cannot affect him. I've studied a lot of hard martial arts. I can hurt people. I can do all sorts of things with my feet, my hands, and there's nothing I can do to him. And the harder I use muscles, the more muscle I use, boxing, taekwondo, the more violence is directed back at me. Not by him, but my own violence.
Try it one more time. Try to throw him. Millions of people are going to be watching, and I want to see you try to throw him. Really, this is for real. This is not a stunt.
No stunt, and I wouldn't be here to waste my time if it was a stunt. And we haven't done this in 2 years together because the last time I did this with him, I got very hurt in my spine.
How long have you studied here?
I've been here now 4 years, studying with him every day. So if I can do what I'm doing now and affect him, upturn him, that means I've graduated to the next level and he would teach me something new.
All right, let's see.
So for me, it's very important that I do this, that I actually affect him.
All right, let's see it. Come on, Andrew, give it the old heave-ho.
Come on, Andrew, it doesn't look real.
So, you didn't do it.
No, not yet.
4 more years?
4 more years.
Oh.
This is the strangest and, to me, the most unbelievable form of traditional Chinese medicine. It's called external Qigong. This doctor claims to be using his energy to help redirect the flow of the energy of the patient. When this doctor claims to be emitting energy, he's doing the same thing that the Qigong masters who we've seen in the park claim to be doing, that at an advanced stage of practice, they can move energy outside their body. This has been the claim for hundreds, if not thousands of years.
The closest I've ever seen anything to this is looking at people who claim to be faith healers in our culture.
I think in every culture, and in fact every medical tradition until ours, a lot of medicine was based on energy and the ability of people to move it. And that's what this man claims to be doing as well. 这一位他有什么样的病？
这是一个脑胶质瘤。
我可以问他？可以。
慢慢。
请问你贵姓？
姓刘。
刘。在给你发功的时候，你有没有感觉？
头顶发热啊，这边又觉得有点那个胀，特别有劲，反正就跟那个一缩一收一缩，就血管似的，就跟里边啊。还有就是有时候是出汗的感觉，就是这半拉有汗，就流。
这是因为他用他自己的气影响你自己的身体。
这个用自己也行，就是没有这个效果那么快
啊。
得自己做到一定程度，入了境以后做了功。
这个发功的情况，你可以简单介绍。
来说明这个问题也是非常难的，
说不出来。
就像我上一次和先生说过，中国有句话叫“只可意会，不可言传”。明白这个道理，还真正明白道理，真的自己练功，要按照我的话说，要到门槛里面来。外 歪气这个事情，我们要慎重，因为有些人不理解，有的是否定它。我说还是要轻易的否定它，但是呢，也不要把歪气看得很深，也就是说把它估计的特别高，要使它进行很好的发展、进步的探索。
I didn't know what to make of Dr. Liu and the emission of qi to cure diseases. To be honest, I'm too much of a Westerner. He just didn't convince me. But for most of the Chinese and eminently practical people, qi isn't something to be pondered. It's just a part of everyday life.
这是长了，然后扣出去，这手对这个腿，这手对这个腿，这是这个。
David introduced me to Ma Yao Liang, one of the greatest living practitioners, a grand master of Tai Chi Chuan. What's amazing is that he was trained in Western science and ran the clinical laboratories in a prominent Shanghai hospital. But at the same time, for more than 70 years, he has taught and practiced Tai Chi Chuan. He is now 91 years old.
我开始练太极拳的时候，为了我自己的以后呢，才明白太极拳不但是为身体好，还可以直接治疗一切慢性毛病。太极拳没有神秘的，难在什么地方？能够这个恒心。我八线气。我练了10年就知道了，但是运用它呢，要30年了。你有了好处以后就不间断了。你比如说我的学生里头，现在90岁以上的人，到最高的是97岁，现在还有5个。那么80岁以上的人呢，很多很多的。我们中国有一句话，练功夫到了相当的时间，可以返老还童。老年人的跟小孩一样。
You're not an acupuncturist, you're not an herbalist, you're not a doctor of massage, you're an internist at a Boston hospital. What practically do you think this has to offer your patients and your practice?
I wonder, you know, when I'm asked the question, what do you think, Doc, does it do the job? I don't know. To know, there has to be a marriage of Chinese medicine and Western medicine. The two sides have to come together because the Chinese doctors are not trained in science. They don't know about control groups and randomization and statistics. That wasn't part of their theory any more than Western-style physicians know about qi.
In a medical sense, I guess this marriage has to be tested just like any good drug is tested back in the United States.
That's right. And you need to apply the sharpest, most insightful science to figure out, does it really work? Is it helpful? Is it safe? Does it save money? That's what needs to happen, and that's never happened before, either in the West or in China. So the offspring of that marriage would be a brand new thing.
What about yourself, David? Have you found what you're looking for?
Well, I've learned a lot about health and how neither the Western medical system or the Chinese system has all the answers. I think that there are a lot of things here that have helped me understand the limitations of medicine, that we in the West don't have a monopoly on understanding the human body or the relationship between the mind and the body. I think many, many people in America now want their doctor
to be very much like the ideal Chinese doctor, a teacher, an advisor.